All right, so laser is our next form of modality that we'll use. Few interesting things about it. I hope that we don't get too bogged down in the physics of laser. Hopefully we can really focus on more of the application stuff. You guys that work in outpatient places, you guys have laser? You do, you don't, you guys do, you work at the same place and you're saying, yes, I do, no, I don't. I have one friend that uses it a lot. One of the year twos, her first clinical, they had a laser and they wanted to use it when she was there, and nobody knew how to use it because nobody had used it in years. And luckily, she had my wonderful notes, and she was able to teach everybody how to do it. So, little all over the map for it. My friend who uses it a decent amount, he says he really likes the effects that the patients get from it. As we'll see later, one of the things, the downsides of laser is it doesn't do a great job with a non-painful stimulus. We'll look at some of the reasons for that. So if you've got a patient that really needs that type of sensory input to interrupt the pain cycle, I don't think laser is a great thing for that. Physiologically, I think this is one of the better modalities that we do have, though. So, what is laser? Light amplification by the stimulated emission of radiation. Jonathan, here's where you're going to start helping us out with the mechanic stuff, okay? So what happens here is all the photons move in the same direction at the same frequency and same wavelength. So white light, the light that's coming from sunlight and from these lights on the ceiling, many different waveforms, frequencies, so the waveforms are not universal. And if we wanted to think about this, if I took a flashlight and looked my chicken coop, depending on how far away I am, that light might not reach it. But if I took a laser pointer, I could have a laser pointer point to the chicken coop from a far distance. Does that make sense to everybody? It's sick of me talking about my chickens. Is that what you said, Isabella? Yeah, I could blind the chickens. We don't want to do that. Why do I want to look at my chicken coop? Because of all of the photons are moving in the same frequency, same wavelength. They're all uniform. The one picture I saw of this when I was glancing just a moment ago is here's the not perfect LED versus laser, but all of the beams are coherent. Everything's moving the same pace, I guess is a good word for it. Everything's moving at the exact same time. If you were in a rowboat with a couple of friends, everybody had sets of paddles. When we watch like Olympic rowing, they're all moving at the exact same time. Everybody's oar hits the water at the exact same time, right? If everybody just said, okay, go, and everybody was just going at their own and not in unison, what's going to be faster and more powerful? Everything at the same time, right? So that's why. Does that make sense? All right. Laser is not white light.
That's correct.
That's correct, yeah. So the type of laser we use in the physical therapy world is termed low-level laser therapy, or LLLT. That's another name for it if you wanted to look stuff up. It's a class 3B laser. It can cause mild tissue heating. It can cause retinal damage, so we're going to be using safety goggles. But there are other types of lasers, more powerful ones, that sometimes are used in surgeries, but we're using a class 3B laser. So how is it produced? Well, electric energy is introduced in the chamber housing, also known as the resonant cavity. An active medium such as helium or gallium arsenide gas is in there. There's two mirrors that are parallel to one another. One is completely reflective, the other is only partially reflective. The gas molecules are excited, become unstable, and shed energy. Energy further excites the gas, creates an active photoemission process called propulsion inversion. And then that photon energy, the light, escapes the partially reflective mirror. That's how we get laser light. Jonathan, would you like to explain that any differently, or is that, no, that's okay? So I don't think we have to dive deep into the physics of this. We got laser light, great. This works, okay, great, good, move on. So what did I just do here? Look at this. Ooh, whoa, that's not what I want. All right. Laser light is monochromatic. That means it's the same color, same wavelength. If you entered laser light into a prism, then a rainbow of light would not exit. It would all be the same color. You guys know what a prism is and how white light, if it enters it, shoots out a rainbow. Everybody saw the Pink Floyd album cover. Who was upset about Pink Floyd album cover? Is somebody upset about that recently? Did I see? It is coherent, so all the photons are emitted at precisely the same phase of all other photons, and low beam divergence, which means energy can be focused. So that's the characteristics of laser light, different from other light. So our clinical practice, lasers do not produce heat. They might produce some negligible heat. There might be some sensation of warmth from our patients, but probably not. We are not trying for heat. The maximum power levels are not capable of producing a thermal response. So that's one reason why a lot of times we'll say, oh, we use cold laser. Well, because the goal isn't to create heat. Again, other lasers can do that. They are considered high power, used in surgeries, cutting instead of scalpels. You can use lasers. Go become a surgeon if you want to use those. Laser hair removal, yeah. I wonder what kind of training and licensure you need to operate those. That's interesting. I don't really care enough other than to say that question, and then we'll forget about it later. Yeah, something. I don't know. Something. It's got to be some sort of form of licensure involved. Yeah. So here's the cool thing about lasers: roughly a 5 centimeter penetration depth. So that's really great, right? So even diathermy was what? I thought it was between 2 and 5, but we'll look at our notes to confirm penetration depth. 3 to 5. So yeah, we're at least as good as diathermy, and there's going to be less contraindications, which is nice. No. I'm going to say no, but what do you got, Jonathan?
According to this. Yeah, we can call it. Like I know.
But
about this light recently that like up your friends, but it has like stars on it, and like specifically they said the stars have to be green, like the lasers have to be green. I didn't even know it has something to do with like the red one.
all of the lasers that we're going to be using, well, the LEDs of these are going to be in the red spectrum of light, but I don't have any other information for that. Yeah. I think if we were to look at the light spectrum, you'd probably be able to see some of that. All right, so the physiological effects. This is the important things that we're going to get out of laser. So the light energy is absorbed by mitochondria and cell membranes. The absorbed energy is stored as ATP, and ATP is used to fuel as fuel to produce DNA, RNA, and other proteins for tissue repair. With tissue repair comes decreased pain, restoration to homeostasis, and all other good things that happen with tissue repair. So that's the big thing that we're doing. We're introducing ATP, stimulating those mitochondria to produce more ATP, and good things happen when we have more energy. That's great. So that's at the cellular level. We can also block the depolarization of C fibers, which decreases pain signals from the C fibers. That's that dull, ache, burn type pain, poorly localized. In my example earlier, I said my knee just ached. It kind of hurt all the time, kind of everywhere. And actually, one of the things we're able to do with this, if that is the main patient complaint, with laser, we can either target the tissue itself, say, okay, you're ATFL sprain, let's do laser to that tissue. Or if we wanted this effect, where we're blocking the depolarization of C nerve fibers, we can do it to the corresponding nerve root. We don't have to do it. You wouldn't do it to my knee in that scenario. You do it to the corresponding nerve root to block that pain transmission. So that's a pretty cool thing we can do.
Like, you mean like the spine?
Yeah, right over the spine. Yeah. Will also decrease cell membrane permeability, dilates microcapillary system, which causes the increase of fluid uptake from interstitial spaces, can relax muscle, can improve collagen tensile strength, which helps with healing as well. Some conditions that are indicated: acute injuries, sprain, stains, tears, hematomas, musculoskeletal disorders, RSD, fibromyalgia, inflammatory conditions like tendinitis, bursitis, degenerative disorders like osteoarthritis, maybe some wound management as well. So we have 3 different sources of laser light. The big one that we're going to be using is the laser diode, small spot in the invisible near infrared range of light. This is the deepest penetrations of the tissue that we would need. We have SLDs, large spot in the visible red or infrared range of light. Less penetration depth than the laser diode, a little bit more superficial. So the more superficial, the more SLDs we would want. And the LEDs in the visible red range of light, only a few millimeters into tissue. So really, really superficial, the LED diodes would be. So when we do get a chance to play around with these different heads, we have a bunch of different sizes to them. And you can see there's a bunch of different types of circles to them. And some of them are LEDs, some of them are SLDs, some of them are laser. They all have a different configuration to it. The good thing is when we have a cluster of all of them, well, we're going to get a good range of penetration depth from the very superficial with LEDs, kind of the medium tissue with the SLDs, and then the deepest with our laser diodes. Yeah. I also, when somebody comes to sell you this stuff, I think a lot of times they're going to talk about, oh, well, this cluster we have 10 LEDs in this one, and this is only $1,000 more than the one who has 5 LEDs. And you go, well, 10 LEDs got to be better than 5. Yeah, I'll pay the extra $1,000, but really it's just doing more of the superficial. So I think knowing the mechanics of this is really good. Although I think you guys are a few years away from your purchasing power on influencing your clinics what to buy. And I don't think you're going to buy lasers anyway. So different size heads, different combination of diode clusters. The more diodes, the more powerful, more power is available. The bigger surface area you can use. When we look at some of these, you'll see some of them are very small, just a couple of diodes, and we got one thing that's like this big, and it's 400 diodes, something crazy. We'll see if we can dig that out somewhere. It's locked to, I don't know where that one is. Tony keeps it hidden from me. So indications, anything that we need tissue healing, pain management, both acute and chronic. Again, I question the non-painful stimulus. There's some things we can do to influence that. Does block the C fiber depolarization, decreased inflammation. So again, physiologically, I think it does do a decent job. Psychology wise, though, I think we're a little suspect on that. You guys will play around with it and see. Now, I will also say the placebo effect we've talked about a lot this semester and how powerful it can be. And we just talked about ritual, right? The ritual of pain relief, the ritual of come in, I'm going to do something to help your pain. Sometimes that ritual is good. So when we say, okay, patient, you need to put on these protective goggles because I'm going to use this like magical machine and it's going to turn on, it's going to beep. And then when I press it on, the LEDs are going to emit red, and that color, the light emission is nice. And, if our patients are intrigued by that stuff, then great. We're kind of impacting the non-painful stimulus, but it's not necessarily a contact stimulus. It's the patient's psyche of, oh, wow, this is cool technology helping me. Right. So that can help, but I'm a little skeptical. I think we have other modalities to improve our non-painful stimulus. So contraindications, children over unclosed fontanelles. Those fontanelles close around 18 months. So that's that soft spot in the skull. The bones haven't grown quite a lot yet. I don't know why you would do that. I don't know why. I mean, it's written in the contraindications for a reason, where somebody came along and said, you know what I'm going to do? I'm going to put laser to this kid's brain and they're going to become really smart. Or I don't know what the thought process was, but don't do it. Epiphyseal plates of growing children, fever, temperature of 100.4 and above. Why? Because fever indicates risk of infection. Yeah. We can use it with a pacemaker, although we would avoid the thorax with it. So that's good. So we can do it away from the pacemaker, just not to the pacemaker itself. Cancer for everything and to the eyes. Our precautions is we are going to be using this protective equipment. And then in our class, if you are working, obviously, you and your partner are working together, you're playing with laser. Be aware of the people closest around you too. Make sure they know so they can either turn their backs or put on their own protective goggles. Let's make sure we take care of each other. Precautions, local applications to the gonads, vagus nerve, or heart. The one that we probably we need to think about is the photosensitizing medication. Anybody ever been on a medication? Usually it's an antibiotic that the docs will say you can't be out in the sunlight when you're on this med. So those type of meds we wouldn't want to. So that's one that a unique one for a laser. Within 4 to 6 months of radiation therapy, recent 2 weeks steroid injection. Another safety thing, either tattoos or dark pigmented skin. That is going to increase the absorption and penetration depth of the laser energy. So we would cut the dosage in half for what we would want when we look at some parameters. So we can do it directly over the injured tissue. I think over the trigger points and tender point, that's probably a really good way to do it. Referred pain sites, and this is what I was talking about, maybe over the nerve roots of the involved tissue. And again, purely just to block the C fibers transmitting that pain signal. Acupuncture points potentially. We have a map of acupuncture points somewhere. Maybe we don't. Thought we did. All right, so the guidelines is we want to maintain direct contact with the skin at 90 degrees. So all of our heads have a little angle to them. That's for your ergonomics. That just means place the head of your laser directly onto the skin. You don't have to say like, oh, well, this is at an angle, this would at 90 degrees. No, place it firm contact all the way against the skin. Firm enough pressure that the patient can tolerate it. And I think this is where we can have some impact on that non-painful stimulus, especially if there's a trigger point. Sometimes just having, anybody ever have a trigger point that, you know, you go to press into a muscle and you go, oh my God, that's it, right? So if we can do that, if our goal is to target that trigger point tissue, then we can have heavy pressure here, and that could increase the non-painful stimulus potentially. But enough pressure that the patient can tolerate it. There are some techniques where you can hover above the skin, 4 to 9 millimeters above the surface, so it's still really close, but you can hover it when direct contact is contraindicated. Good for wound healing, I guess, although I haven't seen this really used for wound healing. But if we are going to do that, everybody has to wear eye protection. For our clinical practice, both patient and clinician should be wearing eye protection anytime we're using this. It's definitely when we're using a hover technique. Something else interesting, we could use after ice or before heat. So if we knew the tissue we wanted to penetrate was really deep, it was towards that 5 centimeters or maybe a little bit more, vasoconstriction would assist penetration. So if I did have somebody's low back I wanted to do it for, I'd probably do ice first and then do laser, just to make sure I get all of the penetration depth that I possibly need. Where if we do it after heat, it will decrease our penetration depth. I think that's going to be an issue for our patients who have heated car seats in the winter. Drive in, have those heated, that's a heated car seat. My wife just on all summer long, it's on. I go, it's fucking 95 degrees out. Oh, but it feels so nice. Oh, it's the world. When I drive my, I'm dripping sweat. Yeah, I know. Whenever I drive my wife's car, all the heat everywhere is on, and I just don't. Yeah, but I do think that's something for us, our clinical application. Our patient drives to our clinic with their heated seats on, and then we're going to do laser immediately. I think that's where we get some user error with this. So the dosage, we want 7 to 10 joules per centimeter square. Higher end, the more joules for the deeper target tissues and chronic conditions. Generally 2 to 3 times a week. There is a cumulative effect where we might not notice the difference walking out of the clinic today, but after 2 weeks of doing these, there is a cumulative effect by stimulating that mitochondria and ATP synthesis. So that's something else we should educate our patient on. It's not like most of our other modalities where they have an immediate sensation that they can say like, oh yes, you put hot back on, I feel warmer. That's not that way. All right, so we can have it either continuous or pulsed. The pulsed, the slower the hertz, the slower the cycles per second, the deeper the penetration. If we go back to our rowboat analogy, if I did, 1 paddle per second versus 10 paddles per second, which one's going to propel my boat further along? You think? How much, in order to do 10, I've got such a, all right, let's think about the heart. When my heart is contracting a whole bunch, really fast, really, what do we call that when it contracts really, really fast? Tachycardia, we could also call it AFib, right? So what's the big problem with AFib? We're not actually pumping the blood out versus why do athletes have such low heart rates? Because the athlete has a really strong heart. When it contracts once, it's going to eject a whole bunch of blood out. So I'll try to come up with a visual of why the slower the hertz will penetrate deeper. I have a little idea on that. So depending on the target tissue that you want, and again, another reason to always have our tape measures on us when we're doing this in this class, just to really get a good idea of what is my penetration depth, what is my target tissue I'm looking for. So 5 hertz would be the deepest. More superficial would be 3000 hertz. Some machines will have a sweep setting, which will fluctuate within pulses itself. I believe, I forget which machine had it. We'll see if we can figure that out. But so that's a nice thing. So if you had a big tissue, that hamstring, I got a whole lot of tissue here, having a sweep setting is a nice way to get all of the tissue that you could possibly want. To document type of gas used, I haven't seen type of gas used just because usually the clinic has a laser. It's not like, oh, well, would you rather have the helium or the gallium? No, we just have the laser. So usually that's not documented. The wavelength of it, how much power you put, the treatment area, how much time you did it for. The number of diodes, again, if your clinic only has the one laser head, you're probably not documenting, oh, I used the 9 diode every single time. It's you did laser and that's the one that you've got. How many joules of energy is delivered to the patient is really important. And then what is the hertz, the parameters for that? Yep.
What would we do for a time of exposure? Because everything else is like, oh, 5 minutes. This doesn't say.
Great question. What's going to happen is when we we're going to set the depth. And we want to deliver how many joules of energy to the patient? Between 7 and 10 joules. So all we're going to do is we're going to say, okay, I want this tissue, this many joules, and then the machine will know how many lasers and diode clusters being delivered, and it'll automatically calculate the time. Usually it's 40 seconds or less is how much time it would need. But I also have something else for you. So in your Blackboard, over here, guidelines for treatment with laser therapy. This is from the World Association of Laser Therapy, I think is what it's called. So we have diagnosis, how many points to use, how many joules should be used for that or delivered to the patient. So this is a nice thing for us just to use as a reference. So if we do have that lateral epicondylitis, you're going to use 1 to 2 points, mostly depending on the size of your head here. You want to deliver, well, 7 to 10 joules is what we would want. We will ignore that for now. But yeah, all it is you're going to mess with the machine. The time will be calculated for you. Okay. All right. So what we're going to do now is we're going to start messing around with the machines. So I have not figured out this machine yet. This one, we're not going to use quite yet. I'm going to play with this and make sure it's safe to use. But these Chattanooga machines are nice for us. So the big thing, so we have in these boxes here are a bunch of different of these laser heads. You're going to have to plug the laser head into the front here. And in order to have the laser therapy worked. If I tried to press it, the laser therapy on the selection screen now, it won't work. I have to plug in the safety switch. So once I plug in the safety switch, then I can start selecting laser therapy. See it on this screen at all, so. Oh, well. All right, the pin for all of this, there's a little code, it's 1111. And then we get to select laser therapy and adjust our settings. So we get to select our frequency, again, continuous or pulsed, depending on the settings that we want, the tissue that we're targeting. Just depends on the depth, so we can change the depth of that. Perfect. Set how many joules we want to deliver. Want to deliver close to 8. There you go. This is going to give me a 9-second treatment time.
Oh, okay.
So all I did is select the depth, selected how many joules I want to deliver, and then that's it.
Okay, so we're not there for like 10 minutes, just, oh my God.
Nope.
You're just like sitting there holding this thing up.
Yep. So once I've got everything set up, I'm going to press start. I put my safety goggles on. So nothing is happening yet. Come in contact, then I press the start button. Now you can see, you guys see which type of diodes are emitting that color. LEDs, yeah, the LEDs. So that's it. You can see that tissue lighting up. Okay. You can always press stop. The patient can always press stop. There you go. It stops. We're all done. So. All right. So we have a handful of these machines out here. We have a handful of these laser heads. I don't want you to play with these yet. Tony just showed me this thing. Light pad. She just, I don't know. This looks pretty cool. Placebo effect of this versus the laser head, the head. What do you think? Yeah, probably. Yeah. Okay. Lay down, put on these goggles. We'll put this on you, yeah. So we'll play with that. I haven't seen that before. All right. Do we have any questions? Yes. Yeah, carotid is that's the big area that I'm worried about. I don't think our penetration depth is too deep. But if we are stimulating that vagus nerve, what are the signs you think you would see? Sympathetic nervous response. Sweating would probably be the obvious one. Yeah, increased heart rate, increased respiration rate, any of those signs, then you'd say, oh, I wonder what's happening here. Don't worry, we only got 8 seconds left. Yeah, probably not. I'll probably cut it. All right, so I want to play with this stuff. What I'd like you to do, let's go through a handful of these areas. Try to hit 3 or 4 of these areas. Again, if you have a contraindication you don't want to use this for, then feel free to not. But pregnancy is not on our list of contraindications, although I would stay away from the uterus. So it's a good rule of thumb, just in general. But that's it. Let's play around with it. We're going to hit a bunch of these things. And then the rest of today, if you haven't done your diathermy comp, we'll get that done. Okay.